Dr. Dan Jones, director of the Bariatric Program at Beth Israel Deaconess Medical Center, discusses lap band minimally invasive weight loss surgery.
If you look at our support group and our information sessions, all the patients who come into us have been on multiple supervised diets. Many have lost 50, 60, 100 pounds, but if you understand the physiology, most of the time that weight comes right back on without something to help you keep it off. It's not just about willpower, there's a lot of hormonal changes that are taking place. The dietitians work very closely with the patients to really have them rethink their relationships with food. So not just picking out healthier foods, but making good choices. When you first get done with the lap band, you start off with water and then some protein supplements. And then what we try to do is introduce protein and liquids. But once you're a year or two out, you could eat anything you want. So the idea is not to eat everything you want, but to rethink what you're choosing for your diet.
What are some of the benefits of surgery?
We know that we can see major health benefits losing about 16% of your excess body weight. So 20 to 30 pounds are going to make a difference in back pain and knee pain. Lose a little bit more, get off some insulin if you have diabetes and a CPAP machine. But you're not going to be skinny mini, or at least most people aren't. They're going to lose probably 50% of their excess weight. So if you're 100 pounds overweight, most patients can lose half of that extra weight. And with extra effort, you might be able to lose 70% of your extra weight. So those are good numbers by most counts. But it's going to require coming back and seeing the nutritionist, seeing the surgeons, getting those adjustments that we talked about. You can't just do it yourself and not come to support group.
What are some of the risks?
There's no operation without risk. A lot of the patients that come to us, even when they're young, have underlying heart or lung disease and things like that, and they know that's why they're seeking out the operation. So there's real risk with any operation, and even though we think of the band as being safer than, say, the gastric bypass as a weight loss operation, any operation carries risk, whether it's clots in the legs that go to the lung, anesthesia risk, and so none of these things should be taken lightly. But on the other hand, what we can say is there's a lot of people who are actually doing really well. When you lose the weight and these comorbid conditions get better, we know that in the end, there's a survival advantage to actually getting rid of those comorbid conditions. So on all, it's a good choice for most people. As a surgeon, we get the band in there as safely as we can, and we make sure we have the educational materials and the multidisciplinary team to really support them. But this is really work that patients do, and they deserve all the credit.